For the procedure, introduce yourself and verify the client's identity. Explain to the client what you are going to do, why is it necessary, and how the client can cooperate.
Good morning po, ma'am. I am Sajili and I will be your nurse for today po. May I know your name as well?
Good morning, nurse. Ako nga pala si Mrs. Sajili.
Okay, Mrs. Suma, pretty name. So what I am going to do now is I will be assessing your head, your face, eyes, your nose, your mouth, your ears, your throat, and your neck. Clear po ba, ma'am?
Hindi na po.
Perform hand hygiene and observe other appropriate infection control procedures.
So are you fine with your position na po, ma'am?
Yes.
Assessing the head. Ask the client for any history of headaches, jaw tightness or pain, food, drug, or environmental allergies.
Okay, so have you been experiencing any headaches po? Or do you remember any moment that you experienced severe headache?
Wala naman.
How about pain or tightness in your jaw area?
Wala.
Okay, so allergy on food, drugs, or environment?
Allergy sa pagkain.
Anong specific food po?
Gaya ng itlog, mayonnaise.
Okay.
Inspect the skull for size, shape, and symmetry. Palpate for nodules or masses and depressions. Use a gentle rotating motion with the fingertips. Begin at the front and palpate down the midline. Then palpate each side of the head.
Tignan ko po yung ulo saglit. Hawakan ko yung ulo niyo, mama.
Assessment of the face. Inspect facial appearance, symmetry of facial features, lesions, and facial movements. Ask the client to elevate the eyebrows, lower the eyebrows, close the eyes tightly, puff the cheeks, and smile.
Can you elevate your eyebrows, ma'am? How about lower them or frown? Okay, so can you puff your cheeks now? Okay, how about a smile? Well done.
Palpate the temporomandibular joint for range of motion and crepitation. Place index finger over it and ask the client to open mouth, and sinuses for masses and tenderness.
So, hawakan ko po ulit kayo, mama. Can you open your mouth? May masakit po ba?
Assessment of the eyes. Ask the client of any eye problems or vision problems, use of eyeglasses or corrective lenses, previous eye surgery, injury or eye infections, and history of diabetes or hypertension.
So, any problems, ma'am, with your eyes and vision?
Meron po. Malabo po ang kanan ng mata ko.
So, may grado po yung salamin niya.
Meron.
Okay, so, nagkaroon na po ba kayo ng any previous surgery, injury, or infection sa mata?
Wala naman po.
Any history of diabetes or hypertension?
Wala.
Okay, so,
Inspect the eyebrows and eyelashes for evenness of distribution or alignment.
tanggalin ko muna, mama. Hawakan ko.
Inspect the conjunctiva, sclera, and iris for color. Inspect the pupils for color, shape, and symmetry of size. Assess each pupil's reaction to light. Ask the patient to look ahead and using a pen light approaching from a side, shine a light on the pupil. Observe the responses, then do the same on the other pupil.
Okay, ngayon tingin po tayo ng diretso, ma'am. Straight forward.
Assess near vision by providing adequate lighting and asking the client to read from a magazine or newspaper.
And pwede niyo po ba itong basahin? Can you read this one?
More fireworks display areas identified.
Okay.
Assess distance vision by asking the client to sit or stand 6 meters from Snellen's chart, cover the eye not being treated, and identify the letters. Take 3 readings, right eye, left eye, and both eyes.
Now, please cover your left eye, ma'am, using the index card. Sabihin niyo po kung ano yung nakikita niyong letter.
E, F, E, T, O, Z. Wala na po akong mabasa.
Kabilang mata naman po, ma'am.
E, F, E, T, O, Z. L, P, E, D. P, E, C, F, D. E, D, F, C, Z, P. Wala na po akong mabasa.
Now, do not cover any. Use both of your eyes po.
E, F, E, T, O, Z, L, P, E, D, P, E, C, F, D. E, D, F, C, Z, P. Wala na po akong mabasa.
Assessment of the ears. Ask the client of any history of hearing loss, vertigo, tinnitus, and earache, any discharges or allergies, and use of hearing device.
So, do you have any hearing problems po, ma'am? Nahihirapan po ba kayong makarinig?
Hindi naman.
Any history po of hearing loss, vertigo, or tinnitus?
Wala po.
Sumasakit-sakit po ba yung tenga niya?
Hindi rin.
Hindi rin po kayo nakakarinig ng unusual noises?
Hindi naman.
Wala pong lumalabas sa tenga niya?
Wala naman.
So, hindi po kayo gumagamit ng hearing aid?
Hindi rin.
Okay, so harap po tayo dun, ma'am. Check ko lang saglit yung tenga.
Inspect the auricle for color, symmetry of size, and position. To inspect position, know the level at which the superior aspect of the auricle attaches to the head with relation to the eye. Palpate the auricles for texture, elasticity, and areas of tenderness. Gently pull the auricle upward, downward, and backward. Fold the pinna forward, push on the tragus, apply pressure to the mastoid process, and note for tenderness.
May masakit po ba, ma'am?
Wala naman.
Dito po, may masakit po ba?
Wala rin.
Okay.
With an otoscope, inspect the ear canal and tymphatic membrane for color, position, and integrity. Tilt the client's head away from you and straighten the ear canal.
So, can you tilt your head to the left side, ma'am? Thank you po.
Assess the client's response to normal voice tones. If the client have difficulty hearing, proceed with the following test. Watch the tick test, tuning fork test, and ribble test.
Now, ma'am, I want you to listen carefully. Pakinggan niyo po yung sasabihin ko, then you tell me kung ano po yung narinig niyo, okay po?
Okay.
So, I'll start on this side, then on the other side, okay? Blue, violet.
Blue violet.
Good. Blue, green.
Blue green.
Okay. Very good. Thank you po, ma'am.
Assessment of the nose. Ask the client of any history of nasal congestion, nosebleed, or any changes in sense of smell.
Nakaranas na po ba kayo ng nasal congestion o yung nagbabara po yung ilong niyo?
Hindi pa naman.
Hindi pa. How about pagdirugo po ng ilong?
Dati.
Okay. So, any changes po sa pangamoy niyo? Naranasan niyo na po bang mawalan ng pangamoy?
Wala pa naman.
Inspect the external nose for any deviations in shape and size, nasal flaring, or any discharges. Lightly palpate the external nose to determine any area of tenderness, masses, or displacements of bone and cartilage.
Ma'am, hawakan ko po yung ilong niya, ha?
Determine patency of both nasal cavities. Ask the client to close the mouth and one nares and breathe through the opposite nares. Repeat the procedure to assess patency of the nares.
Ma'am, can you try breathing habang nakatakip po yung kabilang butas ng ilong niyo? Sa kabila naman po. So, wala pong difficulty o pagbabara?
Wala naman.
Okay.
Tilt the client's head backward. Inspect the lining of the nasal cavity and the integrity and position of the nasal septum by using pen light. Observe for presence of redness, swelling, and growths. Assessing the mouth and throat. Ask the client of any history of mouth and dental pain, sore throat, and hoarseness of voice.
Ma'am, did you experience any problems po within your mouth before? Mouth pain, dental pain, or any other?
Dental pain po kapag namubulok ang ngipin.
Sakit sa lalamunan po?
Wala naman.
How about pag-iba po ng boses?
Kapag sinisipon at inuubo, kasi ang liit.
Okay.
Inspect the outer lips for symmetry of contour, color, and texture. Ask the client to purse lips as if to whistle.
Can you purse your lips, ma'am?
Inspect and palpate the inner lips and buccal mucosa for color, moisture, texture, and the presence of lesions. Inspect the teeth and gums while examining the inner lips and buccal mucosa. Ask the client to remove complete or partial dentures if there are any. Inspect the surface of the tongue for position, color, texture, and movement. Ask the client to protrude tongue and move it upward and from side to side.
Pwede niyo po bang labas yung dila niyo? Pwede niyo po bang igalaw pataas? Side to side? Okay. Wala naman pong masakit, hindi naman po kayo nahihirapan.
Hindi naman.
Ask the client to open mouth wide and tilt head backward. Then, depress tongue with a tongue blade as necessary and use a pen light for appropriate visualization.
Nga po kayo ulit, ma'am. Labas ng dila konti ulit.
Inspect the uvula for position and mobility. Inspect the tonsils for color, discharge, and size. Ask the client to say so that the soft palate rises. Elicit the gag reflex by pressing the posterior tongue with the tongue blade. Assessment of the neck. Ask the client of any history of neck pain and stiffness, any problems with neck lumps, and any diagnosis of thyroid problems, surgery, or radiation.
Ma'am, any history po of neck pain or stiffness? May pananakit po ba kayo sa batok or nahihirapan po ba kayong gumalaw ng ganito?
Kapag nagka-stiff neck po, wala naman. Okay lang.
Okay. May nakakapa po ba kayong bukol dito?
Wala naman.
Na-diagnose na po ba kayo sa thyroid?
Iba naman.
So, hindi pa po kayo dumadaan sa kahit anong surgery or radiation? Okay.
In a neutral position, inspect the neck muscles for lumps or masses. Ask the client to do range of motion to determine the functions of the neck muscles.
Ma'am, pwede po ba kayong tumingin sa kaliwa nyo? Sa kanan naman po? Sa harap? Sa likod mo nga. Okay. So, hindi po ba kayo nahirapan? Wala po bang masakit?
Wala naman po.
Assess the strength of the neck muscles. Ask the client to turn head to one side against the resistance of your hand. Repeat with the other side.
Ngayon naman po, galawin niyo yung ulo niyo sa kung nasan yung kamay ko, mama. Kabila po. Okay, shoulder naman po.
Palpate the entire neck for enlarged lymph nodes. Inspect the thyroid gland for symmetry and visible masses. Ask the client to hyperextend head and swallow.
Iyot po natin yung ulo natin yung palikod, ma'am, ng konti. Tapos lumunok po kayo.
Step behind the client, then palpate the thyroid gland for enlargement, masses, or nodules. If enlargement is suspected, auscultate over the thyroid area for a bruise. Use the bell-shaped diaphragm of the stethoscope. In a semi-Fowler's position, inspect the jugular veins for distension. Discard used gloves, tongue blade, cotton tip applicator and gauze properly and perform hand hygiene. Lastly, document findings in the client record.